Assalamualaikum. Today we will discuss about the personality disorder, chapter number 16 from the abnormal psychology book. I will tell you about the personality disorder according to DSM-5 criteria. Simply, we can say that there are three clusters of personality disorder. Firstly, you will draw diagram about the disorders of personality disorders, and then you will write all definitions about personality disorder. For example, we can say there are three clusters of personality disorder. Our first cluster is odd personality disorder. Odd means you can say strange or the bizarre personality disorder. Personality disorder we can say simply in which a person has any problem, frustration, irritation, and so on in the personality factor. If any person had any personality issue, any personality factor, it means he or she had personality factor. And in the personality disorder, our first is odd personality disorder. There are three types of odd personality disorder. First is paranoid personality disorder. Paranoid personality disorder is the disorder about the suspicious of a patient. Second is schizoid personality disorder. And third is schizotypal personality disorder. Schizoid and schizotypal both personality disorder are about the social relationship. And our next cluster is dramatic personality disorder. The clear with the name dramatic personality disorder, a disorder in which a person show his dramatical acting. If any person show dramatically, it means he or she has dramatic personality disorder. Simply, we can say that there are four types of dramatic personality disorder. First is antisocial personality disorder, means avoid the personality, avoid the society. These people are antisocial. Antisocial personality disorder. Next is borderline personality disorder. Borderline personality disorder are the people or the patient like a borderline. Borderline means they are strict. They can't change their belief pattern. They are like a borderline. They are totally strict. They had hard attitude and the hard belief pattern in the borderline personality disorder. Next is histrionic personality disorder, and fourth is narcissistic personality disorder. We can say there are four personality disorder in the dramatic personality disorder. Whenever our third and the next cluster is anxious personality disorder. Anxious means anxiety. Anxiety means feel the fear about something. In the anxious personality disorder, we can say there are three disorders. First is avoidant personality disorder, avoid the public, avoid the person, avoid the people. And second is dependent personality disorder, a disorder in which a person dependent on others. And next is OCD, obsessive compulsive personality disorder, in which in this disorder all ideas will be repeated at the same time in the obsessive compulsive personality disorder. And I will tell you one by one. First of all, you should understand about the personality disorder. What is personality disorder? I have told you already that if any person has a problem in the personality, in the attitude, in any thinking, in any behavior, and so on, it means he or she has personality disorder. We can say simply personality disorder according to the book and enduring rigid pattern of inner experience and outward behavior that repeatedly impair a person's sense of self, emotional experience, goal, capacity for empathy, and the capacity for intimacy. If these symptoms will be created, it means he or she has the personality disorder. And now I will tell you about the first cluster of personality disorder, and our first cluster is odd personality disorder, in which our first disorder is paranoid personality disorder. We can say paranoid personality disorder. A disorder, a personality disorder marked by a pattern or distrust or suspicious of others. If any patient had suspicious or suspect to the others, it means he or she has the paranoid personality disorder. Whenever in the schizoid personality disorder is the second type of odd personality disorder. In the schizoid personality disorder, simply we can say a personality disorder characterized by persistent avoidance. Schizoid means avoidance of social relationship and little experience of emotion. If any person has these symptoms, it means he or she has schizoid personality disorder. Whenever our next is schizotypal personality disorder, we can say a schizotypal personality disorder is a disorder in which extreme discomfort in close relationship like a husband and wife relationship, but extreme discomfort Very odd personality of thinking, perceiving, and behavior eccentricities. It means if these symptoms will be created, it means he or she has type of personality disorder. Our next is about of the odd personality disorder. I will tell you about the next disorder. And our next disorder is dramatic personality disorder. And in the dramatic personality disorder, our first disorder is antisocial personality disorder. A personality disorder marked by a general pattern of disregard for and violation of other people's rights. Mean if any person violates the other rights, it means he or she has antisocial personality disorder against the society. We can say simply, it means he or she has antisocial personality disorder. After antisocial personality disorder, our next disorder will be borderline personality disorder. A disorder characterized by repeated instability in interpersonal relationship, self-image, mode, and by impulsive behavior. If these symptoms will be created at the same person, it means he or she has the borderline personality disorder. Whenever our next is, we can say histrionic personality disorder. In the histrionic personality disorder, we can say a personality disorder characterized by pattern of excessive emotionality or the attention seeking. If any female seek attention of male, if any male seek attention of female, it means he or she has seeking attention problem. If any person has seeking attention problem, it means he or she has histrionic personality disorder, once called hysterical personality disorder. Before these or before the DSM-5 criteria, we know about the historical personality disorder or the hysteria. Hysteria is the latest form of hysteria is the old form of histrionic personality disorder. When our next is anxious personality disorder. Anxious means if any person feel anxiety to the public, it means he or she has the anxious personality disorder. But before the anxious personality disorder, I will tell you about the last type of dramatic personality disorder. And our last type of dramatic personality disorder is narcissistic personality disorder. What is narcissistic personality disorder? A disorder bred pattern of grandiosity. If any person feel grandiose or a big personality own self, need for admiration and lack of empathy, it means he or she has narcissistic personality disorder. Whenever our third and the last cluster is anxious personality disorder. In the anxious personality disorder, our first type is avoidant personality disorder. We can say avoidant personality disorder if any person feel if any person avoid the public, or simply we can say consistent discomfort or restraint in social situation, overwhelming feeling of inadequacy and extreme sensitivity to the negative evaluation. It means he or she has avoidant personality disorder. Whenever our next disorder from the anxious personality disorder will be about the dependent personality disorder, being depend on others. In the dependent personality disorder, we can say that pattern of clinging and obedience, fear of separation, ongoing need to be take care. If these symptoms will be created at the same person, it means he or she has a dependent personality disorder. Whenever our next is OC, obsessive compulsive personality disorder, means repeating the idea. We can say simply intense focus on order line, perfectionism, and control, that the person loses flexibility, openness, and efficiency. If these symptoms will be created at the same person, it means he or she has the obsessive compulsive personality disorder. And I will tell you what are the causes of personality disorder. There are many causes of personality disorder. The most important cultural factor like the Pathan culture, Rajput culture, Baloch culture, and Apswani and strict culture. If any person belong from a strict culture, it can be possible he or she will be victim of personality disorder. There are many other causes can be possible for the personality disorder, but the culture is the most and the major factor for creating the personality disorder. And no, I will tell you how we can treat it. We can treat the personality disorder by the different medication and the different psychotherapy, for example, behavior therapy and the cognitive behavior therapy, and the anti-personality or for the normal personality. There are many medication we can treat it for the we can treat the personality disorder. So our topic is closed, and inshallah in the next lecture I will tell you about the disorder of childhood and the adolescence. So take care. Goodbye. Allah Hafiz.